Thank you, Mr. Speaker. I want to congratulate and thank the sponsors of this amendment for introducing this amendment. It begins to break down the taboo in American politics about discussing drug policy intelligently. It also begins to hopefully result in the federal government having a more humane and human policy on medical marijuana. I heard the gentleman from Virginia say that the DEA says there is no medical use for marijuana. That's true. They've said it. The DEA has no credibility with people who've looked at this on this subject or most subjects with respect to drugs these days. One reason there is no proof of successful medical use of marijuana is because the DEA systematically tries to make sure there's no adequate research on that, denies the use of supplies of marijuana for medical research. But we have ample proof from the 16 states which have legalized the medical use of marijuana. We have ample anecdotal proof. We know that for people suffering pain, for people suffering nausea from AIDS and cancer, for many people, marijuana is the only thing that produces relief and enables them to eat and to get sustenance and to regain weight and to perhaps regain health. We know this. We know this from thousands of cases. The DEA doesn't know it because it refuses to see it and refuses to allow systematic research. That's wrong. It's inhumane. Now, it may be that I wish this amendment didn't specify the 16 states instead of, because maybe a 17th and an 18th will come along in this year. I hope it will. But certainly the federal government has a better use for its resources than trying to prevent the policy that 16 states have adopted, the humane policy of allowing the medical use of something that has been proven to be medically useful in many cases to prevent that. Doctors and other medical professionals ought to determine treatment, not bureaucrats in Washington. So I support this amendment, and I hope that maybe if it passes, maybe if we have a rational policy with regard to medical marijuana, maybe two other things will happen. Maybe the DEA will get its head out of the sand and will permit proper research, so we'll get better research and better results, and maybe also we'll begin a discussion of our general drug policy toward marijuana, which is certainly a much, much more benign drug than alcohol, which is legal, than tobacco, which is legal, and we have a very irrational policy toward it, a policy which reminds one of the policy in the 1920s that had such deleterious effects with regard to alcohol and alcohol use. So I congratulate the sponsor of this amendment for having the courage to help break the taboos concerning this subject and for introducing an amendment that, if it passes, will result in many, many thousands of people being more healthful and more comfortable and will be a great thing for this country. I thank you. I yield back.